Hello, let's talk about the blood-brain barrier and how you can test if your chronic pain and fatigue and cognitive issues are due to a loss of blood-brain barrier integrity. So, really quickly, just to review the blood-brain barrier, I'm just going to say BBB most of the time, keeps your peripheral blood supply separate from your central nervous system or your brain and spinal cord. So it's a barrier that surrounds the blood vessels that are in your head. It allows oxygen to diffuse out to the brain cells, but it keeps everything else contained in the vessels with some exceptions. So it allows things to circulate without necessarily actually touching and interacting with your brain. So this barrier, the blood-brain barrier, is critical to keeping us alive because our brain cannot handle most of the things that are in our blood supply. And that includes our own immune system cells like T cells and B cells. We don't want those in our brain. So we only want things like oxygen, which are very small, to get through the blood brain barrier and actually enter our brain. Everything else we want to keep separate. So we want the blood-brain barrier, as we say, to have high integrity, and that means it's keeping most of the stuff out of the brain. Now, there are some issues that cause the integrity to break down. Some of these are autoimmune disorders like multiple sclerosis and lupus or SLE, but also there are some chronic conditions like high blood pressure and diabetes that can cause inflammation that can over time disrupt the integrity of the blood-brain barrier and cause some leakage into the brain. And so we'll call that increased blood-brain barrier permeability, or we'll call it a leaky barrier. And there's a lot of symptoms that are associated with poor BBB integrity, but the most likely you would experience would be cognitive issues, problems with thinking and memory and word finding and concentration, and then also fatigue would be very likely. So, how do you know if you have a problem with BBB integrity? So, there are two main tools for detecting these types of problems. Now, if you follow my channel, most of the things I talk about, I always have to say this test is extremely experimental and you can only find it in 3 labs in the world. But today is the exception because both of the tools that I'm going to talk about, they're actually routine medical care tests. So they're probably available somewhere close to you. Now, whether or not your physician is willing to run those tests is another matter, but let me at least tell you what they are. So first, there's the cerebral spinal fluid albumin test. And albumin is a protein that's in your blood, but it's fairly large. And so it's not able to get out of the vessels and enter your brain or enter your cerebral spinal fluid. So if we see a large concentration of albumin in your cerebral spinal fluid, that means that the blood-brain barrier is leaking blood contents into your brain, which is bad. So to measure the albumin, we have to do a lumbar puncture or a spinal tap. And that's the one where you kind of get in the fetal position, and then the anesthesiologist or the neurologist will stick a needle between your lumbar 3 and lumbar 4 vertebrae, or maybe your L4 and L5, and they'll draw some cerebral spinal fluid from the sac that's surrounding your spinal cord. And then they'll test the albumin in that fluid. And after you do that, you can do a standard blood draw, from your vein, from your arm, and measure the albumin there as well. And you can compute a ratio between the albumin in your spinal fluid and the albumin in your peripheral blood. And then that concentration of albumin in the CSF should be very, very low because we wouldn't expect that albumin to be able to get into your cerebral spinal fluid. If you find that the albumin in your CFS is high, that means there's a problem with BBB integrity. So that's the first test. The second test is using MRI, and that's the gadolinium scan. And gadolinium is a contrast agent. It's injected in a vein, like in your arm, and then it stays in the blood circulation in normal circumstances because gadolinium is too large to pass through the blood-brain barrier and enter the brain. So if we do an MRI scan of your brain and we see some of the gadolinium, which kind of we can see it as kind of a white spot on the scan. If we can see that gadolinium stuck somewhere in your brain tissue, that tells us that it escaped the BBB and it entered the brain environment, which means the BBB was leaky at that spot. And this is used all the time to find active lesions in multiple sclerosis where there's still a leaky barrier. And of course, since this is a brain scan, it has the advantage of not only showing that there's a BBB problem, but it also shows where that problem is in the brain. So those are the two main tests I wanted to talk about. Now, comparing them, there's really no comparison. They're both invasive. They both carry some risks. I'm not going to really go into the risks of both of these. That's not really the purpose of this talk. Although if you're interested, I can talk about that another time. But just really quick, so you know that there are risks. For lumbar punctures, the most serious risk is infection from poor procedures. That's the most serious. That's not the most likely side effect. Most likely adverse event is a pretty severe headache, and that can happen. There's also ways to mitigate that as well, but headache is still a potential ramification of having a lumbar puncture. Now, for gadolinium, the biggest concern there is gadolinium is a heavy metal, and it's been observed in some cases to stay in the brain or stay in other organs for a long term with unknown consequences. And so that's still of concern. One tool is not better than the other. They're not correlated very much, and so they do seem to measure different types of blood-brain barrier problems. And which one works best depends really on the characteristics of the leakage in your particular case. Just as an example, in general, albumin would be better for more diffuse kind of brain-wide BBB leakage, but then gadolinium would be useful for problems in very specific spots in your brain. Now, should you get these tests? Well, these are both conventional tests. They're used every day, but their use for ME/CFS or fibromyalgia or Gulf War illness or long COVID, that's still experimental. So your doctor may feel that they're not worth the risk, and insurance probably won't cover these tests in those conditions. But I just want to let you know that researchers are looking into the importance of blood-brain barrier problems in chronic disease. We do recognize that this is a potential cause of these symptoms. We are looking into it. I'm working on this area, and I'll talk more about that later. And other groups are looking into this as well. Here's just as an example, here's a paper that shows blood-brain barrier problems associated with cognitive issues or brain fog in long COVID. And there's many other papers like this. So this is an active area of investigation. I just wanted, again, to introduce the concept, and I'll have more to say on this topic at another time. So do keep an eye on this channel, and I will keep you up to date on the progress. So I hope everyone has a good week, and I will be back soon. Thanks.